Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Jay Calvert. Today, I am here with my celebrity plastic surgeon, Dr. Millicent Rovelo. How are you doing?
I'm doing excellent. How are you?
I know you hate that term. That's why I said
hate that term.
So do I.
I hate like that entire string of words put together.
When somebody says, well, I'm a celebrity plastic surgeon, I rarely want to punch somebody in the face who's from our profession, but that's the moment that when they say it to me too, I just go like, wow, you're a celebrity douchebag. You're a celebrity loser is what you are. Celebrity plastic surgeon so-and-so. Are you kidding me? For
that's
real?
Lame. Like, I don't know any legit plastic surgeons that actually really call themselves that.
No, the legit plastic surgeons do not call themselves that.
And in fact, you don't even know who they are.
Right here,
If
dude.
you have to ask who they are, then you don't know who they are.
I mean, it's true. It's like, come on. Anyway, but we are talking about facial harmony, and we've chosen to use some celebrity before and afters to kind of examine when it goes right, why it's right, and when it goes wrong, why it's wrong. Because creating facial harmony in aesthetic surgery of the face is a real issue.
Yes, it absolutely is. And I do want to give just a little caveat on this, because there's a reason we haven't done a podcast like this so far, because I actually really hate this topic. The social media, the tabloid, the articles that come out like so-and-so had bad plastic surgery or so-and-so befores and afters, and oh my gosh, they had plastic surgery. Because you and I are going to have an academic discussion about it. But the shaming that the general public loves to put on celebrities who have had plastic surgery, whether it was good, bad, or otherwise, drives me up the frickin' wall because it's petty, it's
you can
jealous.
Say fucking if you want to. I know you want to say it. You can. It's okay. It's like one slip. They won't ban our podcast just yet. So
I'm trying to be judicious with the use of it.
Thank you.
Otherwise, it'll just be like a sailor room up in here. But I don't like that topic because I find the tone of it so obnoxious that I can't, like, who cares if that person had plastic surgery?
Exactly.
Or plastic surgery. Who freaking cares? So that's why I don't like to typically talk about this. But I think in the context of what we're going to talk about, it is helpful to see some people who may or may not have had plastic surgery and to talk about it from like a genuine academic plastic surgery specialty viewpoint.
Yeah, and these could just be, any before and afters. I could have taken them off, our friends' websites. I could take ones off my website I don't like, quite honestly. There's ones from like 10 years ago that were relevant then, but trends have changed.
Right. So the topic of harmony that you're bringing up is very appropriate because a lot of times for the average person who doesn't understand or know how plastic surgery works, they may not be able to pinpoint exactly what a person or a celebrity has had done, but they just know that to their layperson eye, that person looks strange. And that is the disharmony that you are referencing.
Right. And what caused me to go to this topic was a plastic surgeon who I kind of know, who's somebody that is, seeing me at meetings and stuff like that, called me about a recent series of posts. I'm posting this story of a patient of mine who's in her 30s, who's had facial rejuvenation surgery, not to rejuvenate her, but to literally change the shape of her face and make her better looking. Mm-hmm. She didn't age. She hasn't aged yet, but she didn't like what was happening to her face. Her face was changing. She had a boxy jowl. She had clearly marionette lines, and she's in her late 30s. And she said, do I need a facelift? And I said, 100%. And it wasn't because she got old. It's because it was making her less attractive. Mm-hmm. And the call that came in, it was really a DM and then a phone call, was, how did you do that? How did you take somebody who was feeling the way that they felt and looking the way that they look, do 7 separate operations on them or whatever it was, and make them look not only totally normal, like they haven't had plastic surgery, but made them look great, made her look beautiful. I want to know, and this is their question, how do you organize your thinking to get facial harmony over and over again in your patients? And I said, that's a great question. I don't have time to answer that right now, but we'll do a podcast about it. And so that's why we're here.
That is why we were here. And I will say, because I think we've talked about this before, you like to reference the mantis lift, that there are some plastics.
I don't like to reference it. It just comes up in everyday conversation. The mantis lift is not the name of the operation that this person has given their operation. It's what I call it.
I know.
Because it does. It makes them look like a mantis.
And I will say that...
Like the eyebrows look like the antenna, and then the cheeks and the eyes
full,
together look like those big ball eyes that they have, and then they take out the buccal fat and make the chin look so tiny they look like a mantis head.
Like a mantis. But here's the thing.
It's not cute.
Some people like that look.
They do.
So
many like it.
That's the thing. Like, yes, a lot of us believe in this harmonious look to the face and creating a natural look. Like, oh my gosh, has she ever had plastic surgery? I would never think that. She looks so natural. And that is one viewpoint and one look. But to be fair, on the flip side, there are people that like an extreme plastic surgery look. They want people to know they've had plastic surgery, or they just like how that looks. They like that kind of extreme, perhaps disharmonious appearance. And that's okay. Like, beauty comes in all spectrums. And I think the most symmetric faces that are classically beautiful are actually kind of boring. I like a little character to my face. So there are ranges of what people think are beautiful. And beauty is in the eye of the beholder.
1,000%. The quote that comes up over and over again from me, which I have on my website, etc., is every person has their own vision of beauty. And it's the truth. And
so true.
And so, and I ask, the people that do the mantis lift, and there are several of them that I said, do your patients, because they're great surgeons, they're incredible surgeons,
excellent surgeons.
I said, do your patients really like that? They go, they love it.
Yeah.
And they go, and they say, I know it's extreme, but they love it.
They love it.
And there's a market for them.
Yes. So I have to give credit to those surgeons, and I admire their surgical skill. I really do.
They're fantastic.
Like, people that can create extreme looks and do it safely, like, that's a huge surgical skill. Whether or not you like the aesthetics, that's a whole different subject.
That's right. Some people like to drive a Corvette. Some people like to drive a Porsche. Some people like to drive a Tesla, and some people like a Bentley. And you can pick who's who. But the reality is that they're all good.
They're all good.
It's just different.
It's just a choice.
So facial harmony and how you create that in my world, and I'm going to ask you this very same question, that this surgeon asked me. The way that I do it is I look at what the patient has going on right now. Like, what is it and what bothers them? I have a boxy, my cheeks have dropped and I feel boxy here. I have marionette lines. I need this. I need these things moved around. And I listen to their complaints, and then I look for opportunities to not only take care of what they are complaining of, but what will enhance their beauty, what will augment their beauty in the setting of solving their problems. And so there has to be a top-to-bottom approach. And I never really suggest things to them, but if like a chin implant is in order because the chin's weak and they're talking about like how their neck's not deep enough, then I'll bring that up. I'll say, I think we should put in a chin implant. It'll do this, do that, and the other thing. And so it's all about creating the vision of where you want to go. I don't really ask for pictures of when they were younger.
No.
That's not reality. We're not going there.
No.
No, that doesn't help. And that's sort of a silly exercise.
Yeah.
I look at how they are now, and I want to make a healthier, more vibrant, more refreshed version of themselves with all the safety and power of the aesthetic techniques that I have at my disposal. And that's what's doing it. That's what it is. I never want to go, beyond what in my world is going to create classic beauty. I want them to have classic beauty. I don't want extreme chins. I don't want extreme cheekbones. I don't want extreme anything, quite honestly.
Yeah.
And as I sit here and tell you this, I have a patient that I did this marvelous brow lift on who wants me to raise her lateral brow so high that it actually points like a antenna, basically, and make it more mantis-like. And I'm doing that tomorrow in the clinic under local anesthesia because she loves the effect of what we've done, but can you make it a little more extreme? And I'm like,
okay,
I'll do it. But I'm not using the before and afters from that one. I can tell you that right now. That one's going to go into the where are they now files.
Yeah, don't pass my card around.
It's just like once I do it, like you're out. You have to like say like, I don't know how this happened. I just woke up one day and there might have been a Martian in my room or so. I don't know.
Yeah.
But anyway, it's all about finding the vision for beauty. It's all about finding the classic approach and using your techniques in and fat grafting and lasers and what you're going to do afterwards. It's a project, and you have to look at aesthetic surgery and aesthetics as a it's almost like a health attitude. And if you look at it that way, then it becomes easier to be good at it and easier to understand what it is you're trying to create for yourself, so that long term it's not like, well, I spent X dollars on this facial rejuvenation surgery, and 5 years later I'm disappointed.
Right.
You won't be disappointed if you keep it up. You won't be disappointed if you stay with that same plastic surgeon and work really hard to max out your investment, because people, when they feel good, they live a better, healthier, more vibrant life. That really these operations are so powerful that way.
Oh, I couldn't agree more. That I had a patient just yesterday. She's like, I woke up really early this morning because I had a lot going on. She's like, and I knew that you probably were still sleeping. And I thought to myself, does she know how much she just walks around changing people's lives? She actually said that. I was like, oh.
It's true.
Well, thank you. But yeah, I think there is something to that. Like when you can really make someone feel better about how they look, then they will definitely feel better, have a different energy, and there's a whole cascade to that. So I agree. And I think I probably do something similar to you when I have the facial rejuvenation patients or any cosmetic patient come in, really. The first thing I do is I give them a mirror and I say, you tell me what you don't like. And usually they'll point to this and they'll point to that. And then I'll say, okay, here's what I see. I see the brows have lowered. I see you have some extra skin of the upper eyelids. I see you have this. So maybe they came to me and said, I just don't like my neck. I'm like, okay, but here's also what I see. And then I tell them kind of what I see and what the options would be to fix that. But then I leave it up to them, because some people will be like, yeah, I see what you see. I really don't care about my brows and my eyelids. I really just hate this neck. Great. We'll do the lower face and you're going to be happy and you're going to love it. But if they're like, yeah, I was kind of thinking about that, but I didn't know if we could do it all at the same time. So if you have the patient that really wants to go there and create the whole facial rejuvenation, then you do have to do the top to bottom approach, because otherwise they are going to be not disharmonious. They're not going to look funny, but their face will age differently. The part that you do surgery on, the lower face, will not really age the same way that the unoperated areas will age. So if what you're really looking for is a long-term package and a long-term plan, you do kind of have to address everything more or less at the same time to create that harmony that persists over time with the aging.
Yeah, absolutely. There is it's an aesthetics attitude. I think that's, I'd approach this with a can-do attitude. And I think that's the key. You need to say, like, I'm all in on my looks. And we kind of all are. Those of us that, some people are listening to this going like, I could give a crap. Like, it doesn't matter to them.
I think if they're listening to this, they're not
probably
saying,
not saying
they're
that.
like,
That's true.
Yes,
yeah, no,
I give a crap.
You're a good point. So if you do give a crap, then it's something you do. You get up in the morning, you do your hair, you take a shower, you brush your teeth, you try to look the best you can, you put your makeup on. All those things that make you look amazing and make you feel that you have your best face forward are crucial.
Literally. Yes. And I like what you said about having like a plastic surgeon, a team, because the worst results that I see are people that go to this doctor for that one thing and this doctor for that one thing. And then this doctor revised that one. And then this doctor did that. And they look it. They look like they have a patchwork of they look like they've had plastic surgery because they're always shopping around. And maybe it's because they haven't found a plastic surgeon that they really like. That is totally possible. And they're just trying to find someone that will do a good job for them. And that's definitely a thing. But if you do find the plastic surgeon that's done an amazing job for you on one surgery or another, stay with that one because they're probably going to do an amazing job for you again. And they know you and they know what they did. And you can have a plan and how you heal. And then you can stay with them and do your lasers. And they will tell you need a Morpheus now, or we should do some photo facials. Like there's a harmonious plan for maintaining the results that you achieved. And then maybe in 5-10 years, you need another touch up or you need something revised here or there. That surgeon knows what to do, and they'll tell you when you need something done. So if you find that plastic surgeon that you really like and you trust them and you've had a good result with them, just stay with them.
It's
a little
hard.
loyalty,
It's hard, though. It's hard for them. It is. It's just, but Botox is only $10 a unit this week at so-and-so's place. And, it's normally $12. Really?
I think once we get them in and they've seen the good job that they can have, most patients do stay pretty loyal and they're not going to start price shopping. But that's what I see. When people start shopping around and picking and choosing like it's a buffet of options for their surgeries, that's when it gets a little hodgepodge looking.
Well, and my patients who are listening to this right now who've done that, you know who you are. Yes, I'm talking to you. They know that those results sometimes do not work out. And then tail between the legs, they come back and say, I need help. I cheated on you, and now I'm in trouble. And I'm like, yes, you did.
Yes, you did. And yes, you are.
We are going to have to undo this, and it's not going to be easy. So, with that said,
with that in mind,
let's go to the videotape here,
yes.
as in the words of who is that guy from Sports Center? It was a long time ago, Len Berman. This is one I wanted to bring up. Erin Moriarty. Okay. Now, those of you listening, you can't see this, so if you want to follow along at home, go to Erin Moriarty before and after, plastic surgery before and after at home. First of all, one of my favorite shows on all of the television verse that's out there these days is The Boys. It's on Amazon Prime. It's amazing. We have could they at least sponsor the podcast? I mean, come on. Here we are doing an ad for them. This actress, very beautiful before her plastic surgery. Different after her plastic surgery. There are people that would look at this and say, she looks amazing, blah, blah, blah. But I feel this is my 100% Jay Calvert opinion with, I don't know what this article said that this was presented in. I don't even know if it's real. It might be photoshopped. But what I want to show is why, to me, her looks have changed so drastically that I think she has lost something in this transition. Not that it's bad. She'll do fine, I'm sure. She's a great actress. She's amazing. But she's had a rhinoplasty, you can tell in this before and after. Before, she has a droopy tip, a wider middle vault, and a wide tip. And afterwards, her tip is very sculpted. The dorsum the bridge has become very thin, and the nose is shorter with the tip now going up. She's had other things done, buccal fat, and probably looks like she either had a mid-facelift or cheek implants or something to enhance her cheeks, her zygoma, and the buccal fat taking out cleaned her jawline. Maybe she's had a neck lift or something like that as well, something to kind of get that jawline to be really clean. It's probably the look she was going for. I'm sure she likes it. I'm sure that other people look at this and say, yeah, that's really cool. I liked the before for a lot of reasons. I would have done a rhinoplasty on her in this before, but I think the rhinoplasty is out of sync with her look. It looks it's just too sculpted. It's overdone to me. The nose is too thin. The tip is too sculpted. It's over rotated. I'm sure if we saw lateral, that tip is sitting at about 115 degrees, in the columella or labial angle, as we call it, or the angle of the nose to the lip. So to me, this appears to me like she's had plastic surgery. If you just show the after, that's somebody that's had a nose job that looks like she's had plastic surgery. Maybe she loves it. Maybe she doesn't. I know there are people that do love this look. I have patients ask me for this look. But to me, it's disharmonious because it looks done. It looks like she's had plastic surgery. Now, the camera kind of likes this, more so than this.
Right.
The camera, the HD cameras and the lighting and the makeup, this kind of works with it more so than this, don't you think?
Yes, you're saying that the after is more photogenic and favorable than the befores, which I could totally see. For film, absolutely, because the film usually makes your face puffier and it makes you look wider than you really are. It doesn't always accentuate your natural angles. I couldn't agree more. So my comment on here, and this is where I hate doing this, because I don't know what that photo is. It looks super photoshopped to me.
Correct.
It looks like it's been filtered. I don't know if that's what she actually even looks like. So for me to sit here and say she's had this and this and this done, I don't even know, because that doesn't even look like a real photo right there. So that being said, assuming this is real, I think she looks great, but she definitely looks a lot different. And she just looks like she's, and I mean this like not in a bad way, but kind of processed, like natural and definitely done. I agree with you about the nose. It actually kind of matches her face, I think. Like it's a very done nose for a very done face.
Yeah, exactly.
But I see all the things you're saying. It is a very narrow bridge. It does look in this photo like she's had a lateral brow lift. Her eyebrows are sitting higher. Her cheekbones are sitting higher. She's definitely had some kind of buccal fat removal or liposuction of her cheeks to make them a lot more sculpted. And then maybe some kind of jawline thing. I don't know. She had a pretty good jawline before. So there are definitely some things that have been done there. She clearly has lip fillers in. So she just
you think?
That's a gimme. It's a totally different look, and
Totally
if she
different.
loves how she looks, I love it too.
Yeah, this came up because my one of my employees' kids came to him and said, "What happened to Starlight?" Which is the character that she played. Like he was freaked out. And it's his 20-year-old kid is like, "Dad, like you gotta talk to Calvert. Like, what happened to Starlight? Like, something happened to her. Like, who did that?"
It is very
And I was
different.
like, "It's not me."
It's a very different.
It's just different,
person,
and so that's the thing is that and so important for people listening to realize that it's like, if that's your choice, fantastic.
Yeah.
That's great. For my taste, this is what I would have. I might have done the buccal fat. I might have done if she says I want this, I want that. Great, well, then I'll do it. I just think that the nose, which is so crucial to your look, it just could have been. It could have just been toned back a hair. And I know, like the big thing now is all these photoshopped, by the way, overdone Turkish noses that looks like little tiny little cartoon character noses. That's the trend. That will go away. There's a rib graft in the future somewhere here for me to do. I get it. But, that's the problem is that over time, these don't age out well.
Well, to be seen.
We'll see.
We'll be back in 5 years and let
Let's
you know.
go. Sean, can you go to the next one, please?
Oh, look.
All right, Tom Cruise.
Tom Cruise.
Tom who has aged. He's no spring chicken. And let's also realize that these celebrities get old eventually.
Okay, yes, they age.
They age. Like that.
I can't stand that.
It's going to happen.
We see these photos of look at, so-and-so from when they were 25 and look at them now 65. They've had plastic surgery. I'm like,
shocking.
or
really?
not.
Or they just gotten old.
Or they just got old. Well, look how their face. We were talking about this with Zac Efron. Because everyone said his jawline had changed and he got
he had an
plastic surgery. He had a car accident. But they're also showing photos of him as a teenager with a heart-shaped face, very thin. And then they're showing him as a man, as an adult, with an adult face, with a man face. He's got a heavier jawline. His face is wider. That just happens with age. So, come on, people, stop it.
Yes. And that is really, just go to your own photos. If you take a look at me when I'm 17, like me now, you'd be like, that guy should be shot and put out to pasture. It's over. It's like, it's so dramatically different because that's what happens when people age.
Their face is going to change.
So, and if you have plastic surgery to make things look better for yourself, that's why we're here. That's why so many people come, because they get something done and they feel better about themselves. And it's so powerful. We talk about it all the time, but I think for the naysayers out there and all the trolls that are going to comment on this on these podcasts that we do, it's a big deal. And just as before we get to Tom, I will tell you what happened today is I took down the splint on one of my patients who had a nose that was so crazy jacked up before surgery, and it was twisted and it was dipping, and it looked like something bad had happened in this nose, and nothing had ever happened to it. And the parents were there, and I do a ton of teen rhinoplasty at this time of year, a ton. I think I've done 20 in the last 4 weeks or 5 weeks or so. And the parents went crazy. Like I took the splint off, and the joy of the father's like face was like you could see that he knew that his kid was going to have a different life.
Yeah.
Like he was overjoyed. And the mother was like, they were just giddy, like like school children. They were like, "Wow, oh my God!" You know, and she when she looked at it, I could tell that she was like, "Oh my God,
Whoa,
like this is so different."
Yeah.
I look like, and I don't know that it was even like that comfortable because she was like, "I'm going to have a different life."
yeah,
And I don't think, you know, that the public who never considers plastic surgery and that the people that say, "Oh, you know, I would never have plastic surgery." For those who can get so much out of it like this, they don't consider they're so busy judging,
right.
so busy throwing their judgment on everybody else because they're high and mighty, and how could you do that? They can't understand. Like there was this path of the life going in one direction for this person, which is now completely different and better and augmented and changed forever. They'll never know what their life was going to be the way that it was because now they're on a different path that makes them feel better about themselves and makes them feel like they have the confidence to do the things they want to do. It's a radical alteration of their future that is so powerful. So to the trolls, you know, put that in your pipe and smoke it.
Yeah, go away.
On to Tom.
Trolls. Tom. Okay, so Tom has gotten a little bit of flack, I think, in the media over the last decade or so for looking different. His face got really round and fat at one point. And I don't really know what he's had done, but I don't think he's had plastic surgery. I don't think he's had a facelift. He definitely hasn't had a blepharoplasty. He's not had a brow lift. I don't think he does much but in terms of Botox and stuff like that. Like he looks like he's aged. But he looks great.
And he still needs a spreader graft on the right side.
He still needs his nose done. So, like, maybe
that hasn't happened.
Maybe there was a time when he was experimenting with some fat grafting and some fillers or something like that. It looks like most of that's gone away, and he just looks great.
Yeah, it looks like he's gotten older. I think he looks awesome.
Yeah.
He looks good. I mean, he's in his 60s, you know, so let's start with that. And, I think he looks awesome. He, he probably dyes out the grays, which is, totally cool and fine. But I think overall, I think there was a time when we saw him with it looked like he'd had fat grafting or fillers or sculpture or something. And it kind of looks that way too. If it looks like he got, whatever the sagging skin has been sort of addressed by filling up with some volume.
Yeah.
And I think that's
fine.
That's fine. It's good. I mean, if you need a facelift, get a facelift. I would tell people, especially men, that you don't need to fear the facelift. It is it's something that really can be, and don't call it a facelift for men. Have a neck lift with an upper facial extension. That's
Sure.
what we do for men. Or
Yes.
as my buddy says, when you do the eyes, does it just take care of this? I just want to do my eyes next year, and if you can just, for those of you listening, I am doing lymphatic massage on my jawline, and he'll go, I just want to get my eyes done next year. And so men don't want to call it a facelift.
Nope, it's a neck lift for
It's
them.
a neck lift. It's getting your eyes done. It's something else. But men do not
get
have facelifts ever.
Well, Tom has not had a facelift.
No, I don't think he's actually had a facelift.
Yeah,
I think he's
actually,
done some filler or some Sculptra, which is a great way to go. And I'm next. So let's go to the next one, Sean.
Aw, I love her. This is Jane Fonda.
Yeah. Now she is 11, I think.
Yes.
Is she 102? How old is she?
I don't
she
know
looks
how
like
old she
she's
is.
like 60 years old.
She's amazing. And I love her because she's so public about her plastic surgery.
and she looks great because she's had good plastic surgery.
She's had good plastic surgery, and she's probably had a couple of facelifts, which is great. That means she's had a facelift goodness knows how many years ago, and whenever she needs a little bit more of a nip tuck, she goes back in, gets another one, and she looks fantastic.
I've seen her in person, and she looks incredible. She looks great. She's fighting cancer. This is a woman who has taken her health very seriously. I mean, if you remember, she was like one of the original exercise gals back in the day, before you were born, I think. And she was doing exercise tapes and all that, and fitness has always been important to her. And beauty's always been important to her. And I think this is what happens when you have good plastic surgery. You can be into your 80s and look awesome, and look and feel awesome. And that's all part of it.
Yeah, we're looking at a before and after of her here, but the before is her probably what is that, maybe 20 years
She's
ago?
probably in her 60s.
Yeah, she's already had a facelift here. She's already
looks
had
awesome.
her eyes done.
Yeah, she looks amazing.
She looks amazing. And she's looks almost exactly the same 20 years later.
Yeah, so like
So
that's a big deal.
Yeah. You go, Jane Fonda.
Let's go to the next one, Sean. No, here we go. All right, so this is like
I love this one.
Now, this is awesome.
This is Brad Pitt for the folks at home.
yeah. If you want to follow along, pull up a Brad Pitt before and after 2024, and you'll find this one. It's a good one. This is a
So the before is actually probably like maybe 3 years ago.
yeah. He's probably
4
he might
years
be like
ago.
58 or
Yeah,
57,
and he looks it.
yeah.
He, his eyebrows are low, his extra skin over the upper eyelids, his jawline is not clean, the neck, it's just he looks his age.
Yeah, he still looks great.
Still looks great because he's Brad Pitt.
He's super handsome. He looks amazing, but the aging is there, you know, so you see it. And then he has a facial rejuvenation procedure done oh so well. I mean, this is a great facelift. And this is the thing is that when you've had great plastic surgery, first of all, he should say like, yeah, I had a great facelift and this is what it is.
Yeah,
I think he
call out
kind
your
of has.
plastic surgeon, please.
Yeah, you guys should have like, you know, when you go on the red carpet, you're like, I'm wearing Armani. It's my
Yeah.
dress and my shoes are by Jimmy Choo. And how about like, and the facelift by Jay Calvert, please.
Yes,
like, let's hear
please,
that.
please.
You know who you are. So anyway, this is one of those facelifts that's just awesome. It looks
Okay,
great.
He did not have a facelift. He had a neck lift.
Oh, I'm sorry. You're right.
With his
What am I
eyes.
talking
He had
about?
his eyes done.
That's right. He had his eyes done. I'm crazy. What am I talking about? Facelift. That's so stupid of me.
By the way,
Mistake.
his eyes look phenomenal.
Right,
His
that's
lower lids look amazing. The lid is so much shorter. The
Right, they
crepey
nailed it.
skin is gone. His upper eyelids, if you go back to probably Brad Pitt in his 20s, that's what his upper eyelids look like. He always had a little bit of hooding.
Hooding is normal in men. For those of you plastic surgeons who are listening to this, please don't Bob Costas this stuff. You know, don't take all the fat out of the lateral lids. Don't take all the, you're supposed to have hooding.
Yeah.
That's why it looks good in this setting, because whatever they did take out of the upper lid,
It's just enough.
it's a sliverectomy is what I like to call it. You just take a little bit of skin out. Leave the fat alone. It's okay. And the lower lids are killer. And those
so
are
good.
done. They're done so well.
Yeah. And then going down, you see the jawline is super clean. The extra skin that was kind of coming down off the sides is gone. He looks amazing.
Yeah, it's a great operation.
Yeah.
So that's what happens when you have good plastic surgery. It's the harmony that just looks like he is literally Benjamin Buttoning right in front of us.
I love it.
Sean, next one.
Oh, and another favorite, Dolly Parton. God bless her.
Yeah, she looks incredible.
I also love her. What does it say about me that my all-star heroes are people that have had great plastic surgery? I just love her, and I love her.
Well, we know where this is
in
going.
the right profession.
That's right.
You start with Dolly. What do you see on Dolly?
The jawline is killer. The chin is great. I mean, this is a picture. This before and after is one of her, like probably in her 30s or 40s, and she's 77 or something now. She looks
phenomenal.
great. Her eyes look good. Her brow's in the right position. Jawline's great.
Oh, sorry. Go on.
I was going to say, she's welcome to call about the nose.
Yeah, we're
The
gonna.
nose has descended because probably back in the day she had an old school rhinoplasty, and the nose has probably dropped down, which is what happens when you don't put in a septal extension graft or Kayamo or strut or some sort of tip support. It does drop down, and so she's ready for a little touch up there. I'm happy to help. I'm here. I'm available.
We're here for you, Dolly.
That's not a big deal. She can do that, but the nose needs a little buffing. But the lips look great. I think the neck is good. Everything looks really. She's maintained her look as a 70 years old plus woman, because this is you shouldn't look like you're 20 when you're 70 years old, 77 or whatever she is. You should not. You should look like a great version of yourself at that age. Period.
Right. And that's what I was going to kind of say about her is that obviously, if you know her age, you know that she's had something done, because the average 77-year-old female does not look like that. So you know that something has been done. But if you just look at her, you can't really, I mean, you and I can say what we think's probably been done, but you don't look at her and think like, gosh, she looks done. You just know that she's had to have something done because no one looks that good naturally.
No, of course not. And that's okay.
But she looks great. She's had who knows how many facelifts. Her skin's beautiful. Her eyes look great. Her brows are in a good position. Everything about that is just flawless.
And I do want to normalize, now that you've said it, thanking your plastic surgeon publicly. I mean, let's normalize that. I think
shout outs, come on.
You know, if you're the gaffer on a film, like you get a credit. Like, where am I?
I know. Or like if you post something on social media and you're like,
I could be the gaffer.
Hermes bag, Gucci shirt. Like,
Hell yeah.
how about an at J Calvert? An at Rovelo Plastic Surgery.
That's right. Just a little bit
Right
of
across the boobs.
a little bit of credit where the credit is due, please. It would be really nice, don't you think?
Yeah.
I bet all the
Pipe
plastic
dream.
surgeons would get behind. I bet not all of them would get behind it. I think if they bombed it, they'd be like, I don't need any credit.
Yeah, but if they bombed it, then the person's probably not going to be, calling them out either.
All
So,
right. Wait, do
yes,
we have one more? I think, or is that all? That's all good? All right, we're all done.
that's all she wrote.
All right. Well, I think that's enough for today anyway, in terms of our, you know what's going to happen with this episode too, is people are going to like if you think the trolls are bad now, like they're coming in full force.
Bring it on.
We don't care.
Trolls.
Trolls are that. They're trolls. So for those trolls that do enjoy the celebrity before and afters, there's a ton of them on the internet, and you can find them easily. I honestly don't know if those were real or photoshopped per se. I think that it's of interest when people start kind of diving into it about why they look good or why they look bad. And I think for those of you who are considering plastic surgery, the reason I wanted to do this episode was so that you could do the same thing. You could sit there and have a little bit more power in your decision making rather than saying like, well, this quote is less than the other person's quote. I think you should really be able to analyze those before and afters of the surgeon you're going to and understand like what their aesthetic sense is, what their sensibility is to the look that they create and what they're going to do for you so that you, when you sign up, you get something that you really love.
I could not agree more. This has been a really fun episode. Even though I said in the beginning that I was anti-celebrity makeover shows.
Well, this was an analysis show.
It was an analysis
It's
show.
different.
And we are not celebrity plastic surgeons.
Right now, whoever has that on their website is taking it off right this minute.
Good.
They should. It's
cringe.
It's
cringe.
wrong. It's not a good name. It's not a good name. It's not a good look.
Yes.
I mean, seriously, would you ever put that on your website?
No.
Celebrity plastic surgeon Millicent Rovelo, MD, FACS. No. No, I probably just you couldn't even bring yourself to do that.
But that's okay. There's plenty of those out there that do that, and that's cool too. Find your person, find your plastic surgeon, find who you love.
Even if it is a celebrity plastic surgeon.
Even if it is a celebrity plastic surgeon. That's cool.
Or a celebrity injector. That's the other one. Orla kind of went crazy on that. So Orla's she's our celebrity injector.
But she actually is.
She
just would never say it.
She would never say it in 100 years. Anyway, this is great. Thank you so much for coming in. And I know that you took a lot of energy for you to do this one. So this is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.
Which is where celebrities live.